are your clients telling you that they're finding to be the most challenging part about healthcare reform?
I think the biggest challenge is really keeping up with the legislation. It passed relatively quickly, and as a result, and some of the provisions take effect as of the first of the year, and as a result, the guidance isn't being issued in the normal process where they issue guidance and ask for questions and then issue final regulations. It's just being issued. And some of these issues are important. For instance, a definition of preventive care or what is essential benefits. All those were very important to implement January 1st, and those guidance were very late in being issued. So just keeping on top of that, getting a hold of that, and then people have questions around what certain terms in the guidance means, which makes it very difficult to not only implement but then communicate effectively with your employees.
How can communicators get information?
There's a number of websites. The federal government has put out websites that you can keep up to date on. Most of the major consulting firms have those websites, along with law firms that are putting out not only the guidance itself, but often publications translating those guidance, which is probably more important.
Great. What are your clients and other employers telling employees about the impact of healthcare reform on their health benefits? Are they saying anything at this point?
Well, I think that employees are asking questions particularly about cost. They know that at some level this will impact the cost of their benefits, and so employees want to know what that means. And employers don't necessarily have those answers quite yet because we need to figure out how this will roll through the system ultimately and affect costs. So I think that's one of the questions. And then there are, of course, immediate provisions that will take effect. Changes to age 26 children coverage, changes to preventive care benefits that take effect immediately. And so those questions are coming up right now. But I think the biggest question employers are trying to address is how will these costs impact our benefits?
What is your recommendation to employers for communicating about healthcare reform?
I think there are a couple things that you need to do. One is to communicate what you know and don't know. And it's okay to say what you don't know. I think that that some of the provisions aren't well defined, particularly the ones that take place in 2012 or 2014. And so you can talk about those as they're reading right now in the legislation and what we understand the case to be, that the individual mandate for coverage will come up in 2014. And you can talk to your employees about that, but it's okay to say, but we don't know exactly what that means or how that will be implemented. And the other thing I think is to keep things as simple as possible. The terminology that is being used here is very new to employees, and as much as you can simplify that message, I think that'll be important. For instance, one of the more complicated messages is that the Congressional Budget Office said that this will cost $940 billion. And so people are asking, well, how are they going to get the money for that? The answer is somewhat complicated in that some of which we don't know, and then there are tax provisions that went into place, taxes on individuals and companies and health benefits, and those are all difficult to explain. So as much as you can keep like a few of those points and then leave the rest to, and we're going to figure out the rest later, or the government will figure out the rest later, I think that's important.
Well, it's clear that healthcare reform is going to roll out over the next few years. It's already rolling out. What steps can employers take to set up a process for keeping employees informed?
I think there are two things. One is that an employer can take an approach where you set up a regular form of communication. So we're going to have a bulletin or a newsletter or a series of email that goes out about healthcare reform. And we're going to do this every 3 to 4 months, or whatever your timeline is. And so then whatever you know at that point about healthcare reform, it's a regular communication. One of my clients is setting up an actual bulletin, a newsletter that they are mailing to homes. And for instance, they're a healthcare provider, so their message is a little different. But we're going to do this newsletter every 4 months. And whatever information we have at that 4-month period will be reported to employees. The other thing would be just to create an open dialogue, and that can be done electronically, where you set up an intranet or a web page where people can post questions and then you can answer them immediately. But by creating that open dialogue, when new things come out in the media or at your organization, you can answer those questions immediately.
What is your company doing with this regarding health care? What is your involvement?
So there's a couple of things. One is that we try to keep our clients up to date on the actual regulations and the changes to those. And the other thing that we do from a communications perspective is that we want to set up the strategy and those regular forms of communication and help people simplify that message so that their employees can understand.
Wonderful, and we'll have links on this for people that want to contact you. Is there anything else that you want to absolutely make sure we talk about or you'd like to say?
I think that's it. I think that one of the things that employers can do right now is start communicating immediately. I'm still amazed that, you know, it's the fall now of 2010 and a number of employers haven't said anything to their employees about healthcare reform. And I think, so if you haven't said anything, I think it would be important to go out with a message right now.
Thank you.
You're welcome.
Debbie, one of the things that employees really care about is their health care. And in this time of healthcare reform, there's got to be a lot of anxiety out there. What are you doing within your company to try to limit that anxiety?
I think that's exactly the point, anxiety and emotion. This is a particular piece of legislation that touches people at their core on how they're going to take care of themselves and their family in time of health crises, or just to take care of themselves to keep themselves healthy. And as a result, the communication, I think, is a little bit different than what it might be in other legislation or other topics for employees, because of the level of media coverage that there was. Folks have maybe opinions, whether they're based on fact or rumor, and so you're going to have to cut through all of that in order to get something that's meaningful for people to really understand. So I think some of the biggest challenges are having to do with providing correct information, accurate information, and cutting through what some people may or may not be getting or may have not interpreted. As Kimberlie said, you know, there's a lot of information out there, and there's a lot of things that still have yet to be determined. And so you have to just kind of be careful to talk about what we do know at this point.
How are you as a communicator cutting through all that?
We've chosen to do a couple of things. First of all, we went out a few months ago and basically put a letter out to all of our employees that stated what we did know was going to be changing, that we knew that there would be some impact on the company. But we're very obvious and very specific about the fact that we don't know everything. And so there's basically, it was kind of a more to come message that we sent out. Here's what we do know, and here's where we see, you know, an opportunity to provide you information. We've also weaved it into our open enrollment materials. We happen to be undergoing some changes to our program this year. We felt that providing them with a separate piece on healthcare reform would kind of muddy the other messages that we're having to get out. So we've woven it into our open enrollment communications at this point, and identifying the changes that we're making to our benefit program, what is because of healthcare reform, what is not because of healthcare reform, and kind of leading to the fact that when other changes come along, we'll be letting people know when those changes occur.
Have you had to adjust your schedule for open enrollment to try to give more time for this, or are you just staying with the state schedule that you've had every year?
We extended our open enrollment by a week this year.
And that was specifically for thinking that there would be healthcare reform questions?
Healthcare reform questions, and because we've made kind of an extensive change. So we were allowing for people to digest the changes that we're making, mostly.
Do you measure or get responses from employees to kind of see how your messages are received? In other words, what I'm getting at is you've communicated with them, which is great. You've had to say in some cases, we don't know everything.
Right.
How are employees reacting to that, being told we don't know anything yet, stay tuned?
Actually, the feedback, we haven't done an official or formal type of feedback type of mechanism. I can tell you we just recently did an employee engagement survey, and benefits is a portion of that, as it is every 2 years we conduct those. And we're getting positive feedback as far as what the perception is of what people have and how they feel like they're being communicated to about those benefits. The feedback that we've gotten more on an informal basis has been positive at the fact that we said something, first of all, and that we've said we're going to open up the lines of communication and that you can ask questions. And we have a couple of different options for people to ask questions. We have a phone line that's dedicated to HR benefits and HR information, as well as a form on our intranet. So we've opened up that channel and let people ask questions. And we haven't had really any specific to healthcare reform at this point, but I'm sure that as things continue to unfold, we will.
The days of the company paying for all the health benefits disappeared a long time ago for most of us. Now we're thinking that with these reforms, there's going to be more of a push on the employees to share their portion of it.
Correct.
Is that a concern, and how do you communicate that so that you sound compassionate and yet realistic?
It's interesting you said that, because the first piece of communication we went out with for our open enrollment happened to be exactly about that, about the sharing of the cost. We were very specific as to the cost increases that we've just incurred as a company over the past 5 to 10 years, and basically that we're going to continue to share in that cost. Fortunately, for several years we've had a culture within our company that there is a sharing mechanism both in a retirement environment as well as healthcare. So that's not a new message for us, but it had to be reinforced this year. To the extent to which we talked about healthcare reform specific to that, we were kind of cautious in how we did that. Again, it's a very emotionally charged topic and a very, very political topic, can be, and so we wanted to make sure that we weren't pointing fingers in that healthcare reform's costing us X, Y, and Z. It seemed like a little dangerous place to go.
Wonderful. Is there anything else that you'd like to share with your fellow communicators about this topic to make their lives a little better?
Well, I would say be as informed as you can. Be comfortable. As communicators, we're not real comfortable with saying we don't know. We like to be able to provide something. So be comfortable in that role and be comfortable in advising in that role that it's important to keep up communications, even if maybe some folks on your HR team are saying, but we have nothing to communicate. Sometimes just letting them know that we're still on top of it is enough of a message.
Great. Well, I know the room is filling up with people eager to hear you, so thank you for taking this time, and I look forward to your presentation.
Great, thanks.